and in which Department of Mental Health psychiatrists at several hubs throughout South Carolina provide telepsychiatry services to emergency rooms through high-speed internet connection round the clock. So the Duke Endowment paid for the infrastructure of the telepsychiatry program. And then about a year after that program was established, the National Institute of Mental Health had a meeting whose goal was to pair researchers with state policymakers in states that had well-developed infrastructure for conducting research. And I was one of the researchers, and also at that meeting turned out to be a friend of mine from residency, who was the director of research for the State Department of Mental Health in South Carolina. And we said, hey, there's this great program here, and I had heard about this great integrated data warehouse in South Carolina. And so we wrote a grant to evaluate it and to say, what's the impact of this program on the kinds of things that both researchers and the state cared about, which was how long people stay in the emergency room and costs, and then more downstream outcomes. As we've heard, a lot of this is about partnerships. In this case, my partner was both the director of research for the state and also a professor in the University of South Carolina. The Department of Mental Health runs the telepsychiatry program and was a major kind of advocate throughout the process. And the South Carolina Hospital Association houses the telepsychiatry program. And the research strategy basically was to compare patients seen in the telepsychiatry program to matched patients seen in other emergency rooms in South Carolina using the data warehouse. And we also, and this is something also to keep in mind, in a second phase of the study, we compared them to a number of adjacent states using Medicaid data. So it's possible both to look within the state, but also to compare people within, say, Georgia to other states as well. We've worked very closely with RFA, which David Patterson told you about throughout the process. As he mentioned, they've really kind of make it very easy from a user end. They secure approval from all the participating agencies for the use of the data. They kind of run interference for us. They provide de-identified data sets through secure FTP to Emory for analysis. And we've worked very closely through the years, actually, with one analyst, with one statistician from their RFA who we're just, kind of friends with and can, contact when we have questions. All this to say, it's from the user perspective, a very easy process.
You might want to explain your acronyms.
Sure. Which one? The RFA.
Pick one.
Yes. Okay. Yeah, I have a lot written up there. So the Department of Mental Health, the FTP is the how the files are transferred, the file transfer protocol, and the Revenue and Fiscal Affairs is that the agency that Dave Patterson spoke earlier about. Is that? And I'll make sure not to use letters without full words attached to them. So briefly, the results comparing the telepsychiatry group to these matched controls in our first study showed some impressive results. There were reduced admissions to the hospital, so more people were able to be discharged into the community. Reduced length of stay at the index visit. higher rates of follow-up. So, one of the ideas from after being discharged from the emergency room is having an outpatient follow-up after discharge, and also lower costs, both for inpatient and also looking at inpatient and emergency room combined. So basically, what the evaluation found was kind of more efficient use of services in the emergency room, lower costs, and better linkage with outpatient care. And so the results, from a research perspective, were, contributed to what we know about how a program like this can work, but also had an impact on policy. So this was both kind of internal, the sorts of things I think that the committee is thinking about. It helps identify opportunities to improve the program along the way. So you can look at kind of flow through the emergency rooms, which ones are working better, which ones are working less well, and it's made it possible for the Department of Mental Health to improve the program along the way. Additionally, research findings have been used to get additional funding for the program from the Department of Mental Health through the Duke Endowment within South Carolina. And it's also made it a model program across the country. So there's, as David talked about earlier, there's kind of this virtuous cycle of you have better data, you can kind of understand your programs, and then it gives visibility to the programs, not only within the state, but also across the country. So to me, as a researcher, but also someone who cares about kind of the research being put into practice and improving care, South Carolina provides an example of how to develop and use a statewide data warehouse, how it can be used. And the data systems, can be used, again, both by the agencies to improve their programs, but also for a state to increase its visibility. So those are my comments. I'm happy to answer any questions that you might have about anything.
Well, you were using the telepsychiatry as an example, but at a different meeting on Monday, we had the chair of the American Medical Association this year is from South Carolina, and he was going over that program with us too. And of course, as you know, we've got a huge shortage of psychiatrists in our state, and probably South Carolina does too, and has helped it be effective. So you're saying what you got from South Carolina, what you were getting from them, you can't get the same thing from Georgia right now, or not without a lot of work, or
Right. I mean, the main data that are available for Georgia are Medicaid data. For us, those are Medicaid data that are probably 2 years old. I know you guys have access probably, because we're getting ours from the National Repository of Medicaid data. I don't know the lag time for you, but there's nothing close in Georgia to what we would be able to get, no.
Okay. Dr. Kirkpatrick was over there too, hearing that, weren't you, from the meeting in Rome? All right, any questions anyone has from this group? Well, we appreciate the information, and we're gonna work on making it better for you.
Thank you.
All right, at this point, we are to Teradata, and I know our representative from that group couldn't be here today. He's probably disappointed that this is the meeting he's missing. But,
Hi, My name's Richard Andrews. I'm from Teradata. I am the Senior Director of Analytics that works at Teradata. And I first want to thank you all for having me here to provide testimony about Teradata's view of how to provide a better data management structure to transparency and open access to data within government. And we've been doing this quite a long time, about 37 years, and have a number of implementations to this effect and a number of learned lessons. A lot of the things that were said, but a lot of it is very true. There are slight differences in our approach because our approach more is foundational level. I mean, the reality is in order for you to have an integrated data, you have to build something first in order to get there. So the question then becomes, well, how do you do that and what are the values and what are my challenges? So I'm a firm believer in informal presentation format. Please feel free to stop me and ask a question. At Teradata, we truly do believe that the release of analytics and data is what truly distinguishes a good organization from a great organization. And this was really found to be, in my personal opinion, exemplified by a quote by the CEO of GE, which we engaged with about 15 years ago. And after our first engagement with him and over a period of time, he actually came to the board during a shareholders meeting and said, we want to treat analytics like it's the core of our company over the next 20 years as materials science was over the past 50. And this really was a reinvention of GE at that time. So to kind of give you all a little bit of an idea of who and what Teradata is, if you don't know, because quite candidly, my wife asked me on a normal basis, okay, honey, what does Teradata exactly do? Well, what we are effectively is, and I think the best representation is, who do we work with? Teradata has been in the analytic market space for the past 37 years, and without boring you with regards to we have 2.5 billion in revenue and so forth, really what is a good representation of us in this expertise is by the companies that we support. 18 of the 20 top global commercial banks use Teradata, 19 of the top 20 telecommunications, all 6 of the top airlines, and 15 of the top global retailers. So it's somewhat safe to say, and I feel somewhat confident. Yes.
Just interrupt a second. We can hear you, but there's people live streaming. They can't hear you since you're away from the mic, so that might be helpful.
Thank you. Sorry.
You're being streamed around whether you know it or not. So.
Okay. So from a standpoint of, I think it's somewhat safe to say that every time you place a phone call or you place an order online or go into a store or you conduct a banking transaction, 9 times out of 10, you're probably working on a Teradata system. We're kind of the best kept secret, but in the business community, we're extremely well known and in certain sections of the public sector. So in the state of Georgia, just to give you an idea of some of the companies that we do support, you have Home Depot, Coca-Cola, NCR, Delta Airlines, and Aflac, just to name a few. And all these run on a core analytics system from Teradata. So their entire data management strategy is built upon us. It isn't like we just have an instance there. So before we get into what we recommend y'all do, and quite candidly, you seem to be leaning in this pathway as an integrated kind of data access, data management, is you really have to understand and look at what problems y'all are facing in order to whatever pathway you go, we're going to address the issues that are in front of us right today. And one of the things we've seen is there are 3 primary components to challenges faced both at the legislative and executive branch, and quite candidly, all the way into the agency level, because they are as frustrated sometimes in data access as you all are. And the very first is very access to timely and accurate, just surface level questions that you might have when you're setting certain policy decisions. having access just to mundane data becomes somewhat of a challenge. And thereby you're having a little difficulty in defining, hey, are we doing the right thing here? Take that a step further and start asking more complex questions that the data just isn't housed in one agency, but it might be in multiple disciplines. And in public sector, as you all well know, nothing happens in a vacuum. Everything has a cause and effect across multiple programs, as was discussed in the two previous presentations. So when you start asking questions, and a very good example, because we're working right now with one of our clients on opioid addiction, and we're coming up with strategies of how to combat it. And one of the things that was really kind of a generalized question, but turned into a very hard data wrangling question, is from a standpoint of the opioid addicted population, what is the total cost of services across all agencies, all programs? Because before you can know how to address something, you need to know how big it is. How much impact does it have? It isn't just a healthcare issue, it is a law enforcement issue, it's a prison issue, it's a family involved. So there are a number of different areas that opioids actually touch. And if we're going to put proper policy in place, we need to understand where those touch points are and how can we address it so we can stop this scourge right now that's happening within our nation. And the final thing is, especially for a legislative branch, y'all are very much policymakers. You decide the future direction of Georgia, and the policies that you set forth really are forward-looking policies. They're not just tactically, this is what we're doing today. Tomorrow we might do something different. A policy is a gateway into an outcome that you envision on a longer term. One of the greatest problems within the legislative organizations that we talk with is there's no tool set, there's no capability for you to even model what the future looks like. And so you're kind of stuck with, here I am today and this is the policy, but I really can't predict whether or not this actually will work. We're going to have to do a hindsight view once it's been done. So the question boils down to is, what type of environment do you want to operate in? And the presentations earlier actually lead to the environment that Teradata highly recommends that you all investigate and kind of move forward to. And that is, there are three different really environments. I personally feel there are two. But the three environments are: one, siloed infrastructure. Nobody talks to anybody, agencies don't talk to each other, and even within an agency, things are so segmented. That is the lowest level. And to be honest with you, I'm probably not telling you anything you don't know. That's about 80% of government. It's generally just how we're set up. The second level is some integration with a bunch of data supporting data marts or individual data silos. And this you find, a real good example of this is in a crime analytics data warehouse, where you put all the crime data into it, but they really don't care about social data. They don't care about any other types of data because it's purpose-built. They're there to analyze crime. The problem is crime actually does have an impact on a lot of the social services that you offer too. And the third is an integrated data warehouse, which is what somewhat is kind of recommended by the others, but it is strongly recommended by Teradata because it's what really works and drives value. And even though on the side it shows, you know, the business value growth and the cost to deliver decrease, this actually is point proven within studies by Gardner. The more segmented you are, the less business value you drive. The more integrated you are or holistic in your view, the greater value you drive, and quite candidly, you decrease your costs. To give you an example, and I tried to envision something that was a real life example, but it gave you a flavor for how this should be approached. Because, and I totally agree with the earlier speakers, this is not a Big Bang theory. Big bangs usually do one thing, they blow up. I mean, there is no value in that. What it does, though, is it's incremental. And that's what this slide, next couple slides just go through. This was an engagement we had with a global retailer, and it started about 15 years ago. And I would hazard a guess that every one of you has walked into one of his stores, and that's Walmart. So they started out very much like you are today in a very siloed environment where each piece had its function, but the pieces didn't talk to each other. And in this case, they had orders and inventory. And it's really no different if it's public sector. It's TANF versus food stamps. I mean, they're segmented into different siloed environments. And they had 15 and 25 mission-critical business questions that each segmented piece could answer. And they asked us, well, can we drive value at that time by bringing things together in a holistic view? And what we ended up doing was we ended up looking at those two things together, and we realized two major things existed. In a siloed environment, you ended up duplicating data over and over and over again because you had to. I mean, we talk about de-identified data and identified data. Well, you have to identify who the person is first and foremost in the files in order to do the payroll, to do the Medicaid reimbursement. So that's identified. Well, it's also identified in any type of food stamp program I might be in. It's also identified in all of the criminal justice. It's identified in your education. I mean, you're redoing the wheel every single time that you silo something. So the first thing that we discovered with them is they had an overlapping gross amount of duplicate data that we could just get rid of. Get one identifier. And in this case, it was products, not a person. Then bring this together, and they were able to answer 96 mission-critical questions above and beyond the 25 and 15 that they started with. Said, that's interesting. Well, let's take it a step further. We've got our demand creation bucket that's run by marketing. So let's throw this into the pie. And so they put in marketing and started looking at all the promotions. All of a sudden, come to find out they had 156 critical mission questions they could answer. And if you take a look at it, these are really impactful things that change their business. How are current promotions impacting orders and inventory? Which customers are going to be out of stock that we need to both today, tomorrow, and in the future? It allowed them to actually modify their business to where they became somewhat of a different business, which I'll close with. From this single example, what they effectively did was they moved into an integrated data warehouse just like you're talking about now from the place that you are right now. And the value that they drove in doing this, Sam Walton met with his senior leadership team, and he said, guess what, guys? We're no longer in the retail business. And this was about 5 years ago. He said, we are a logistics company. And if you look at all the brick and mortar companies around the nation, they're one of the very few that is actually extremely profitable because they changed their business model to actually be logistics over their products and how to ship them and how to move them around to get the maximum value and profit instead of being like a retailer that just stocks everything in the warehouse to make sure you don't run out of stuff. So the question always comes up, especially in public sector, is that this is great, that's nice utopia, but we're public sector, and you even identify what the issue was. How do we address it? Because we're not like a private sector entity that's maybe more nimble. Well, I would point you to the state of Michigan, because the state of Michigan was where you guys are right now about 14 years ago. And at the state of Michigan, they effectively said, all right, we need to make changes here. And it's very similar to what was done in South Carolina, except it was done slightly different. Michigan maybe didn't take as coddling approach. They said, you're going to give us your data, period. It's not a choice. It's not an option to you. We're not going to do teaming agreements. You're giving me the data. I have a legal right to it, and I'm going to consolidate it because I need it. I need to be able to see what the results are and start asking business questions because I need answers to them. And because of your structure, I'm not able to get those answers. And it's really not an agency's fault, by the way, and I do want to get this on record, is our federal dollars are tied specifically to projects. And originally the feds wanted all monies for Medicaid to be spent on Medicaid. They wanted all monies for TANF to be spent on TANF. So these systems were designed exactly the way the feds funded them. The problem is in a holistic view of a citizen, that's not the way to service them. Because then you have trouble with regards to what is the best policy? What is the best program could we put forth? Because I don't have a view of them as an individual, I have a view of them in a bucket. And so what they did was these slides I'm about to show you were actually put together by the state of Michigan to educate the new governor who was elected, who is coming in, of what they're doing. The very first thing is they drove $1 million a day, every business day, for the past 15 years out of their business. This is documented, and these are hard dollars. This is not soft productivity gains, so we're going to estimate that was worth $5,000. We're going to throw that into the bucket of our savings. These were hard dollar savings that they actually took out of their business in multiple areas, and I'll go through with them. The major ones were honestly found within the social service arena because that's where the largest expense for Michigan was. The very first were hard dollar savings and consolidation. They turned of all agencies and said, you will give us your data, and we're going to consolidate it in a single platform. And they were able to start removing a bunch of these individual silos and start making them much more efficient in one single location. And if you think about it, every single data repository you have, every database, it has to have software, has to have maintenance, it has to have subscription and support. So you're paying over and over. Now, as a vendor, we love that. I mean, because ultimately you're paying for the same thing at multiple agencies consistently. But as a taxpayer, it's not really a great thing because the agencies are managing to the programs instead of letting the programs manage the constituents. Does that make sense? Yes.
Yeah, so in Michigan,
Yes.
do the individual departments have their own storage, or is all the storage centrally located for everybody?
All storage centrally located. The only thing that resides at the individual departments are transactional systems. Because transactional systems, their inherent nature is to do a transaction. Such as if you're doing eligibility, that's a transactional system because you're deciding who's eligible for what programs. The output, however, from that eligibility, meaning the resulting data, that's imported into the data warehouse. Because now we have a better picture of this taxpayer as to how we're servicing them as a government. Does that make sense?
Yep.
So, yes,
You said they saved $1 million a day.
yes.
For 15 years, they saved a million.
Over the period of time, averaged out, yes. And that's their numbers. That's not ours. And they have already welcomed Georgia because we informed them what you're thinking of doing. They welcomed you guys up there. I mean, it really is amazing. And wait until I get to what they've actually done because it kind of gets cool. But anyway, so this is what they've actually achieved. And these are some use cases, and I believe we handed a brief overview that some of these are actually discussed in. But what they were able to do is, in fraud detection is a great example. they were able to identify additional areas of fraud because, again, they had a fraud system for Medicaid. What they didn't have was a fraud system for child care based upon wages. Well, that would have taken another $5 million purchase because that's a totally different group. Well, the problem you've got with that is that we feel we may have an issue there in fraud, but we're not sure. So are we going to go spend $5 million of taxpayers' money to buy a fraud system on the hunch? Well, all the tools then become consolidated. So this fraud system, being able to build the models to it from Medicaid now could be used for this because it's off of a data warehouse. That's the way it was sold. So all they did was start building additional models for fraud that were specific to, uncovered $70 million of fraudulent claims that were stopped day one. Yes.
So I think originally we probably had, or at least I had the impression, part of the idea for consolidation was just the savings, right, first and foremost, of having multiple systems set up. The secondary one was security, having that bifurcated amongst different departments and groups. But what we're really saying is the icing on the cake here is what you're talking about here, which is having the accessibility data, running the algorithms, and really making some transformational change.
Thank you. I'll send you a check later, honestly. And correct. Because, and I know I shouldn't have said that, sorry. You're 100% correct because where the real value of data is found in how we constituency, not just that we know what the state is. I mean, static information of knowing how many people are in TANF and how many people are in food stamps and how many people get Medicaid. Great. What does that do for you? Tells you how many. Now the question is, how do we get 2 of these people off of food stamps and into the working environment to where they're not on Medicaid anymore? That's a great question because programs. And some of these examples actually do this. And they've gotten amazing results. In the child lead poisoning, do you remember in the early 2000s, especially in the upper Midwest, where lead paint was used a lot, they had a major issue with child lead poisoning because the kids were peeling the paint off and eating it. Well, one of the things that they did was they started identifying all the at-risk children in the areas that the lead paint was identified through the housing databases, and they started an outreach program not just to educate, but also to test kids before they got sick. What this ended up resulting in, that they don't even outline, is a major decrease in Medicaid costs because they weren't dealing with hospitalizations anymore of sick children that had eaten lead-based paint.
So you actually already started to answer my next question, which was using the predictive analytics, right? As we look at folks, whether they needed help from social services or it's medical care, is now we're really looking at the different key indicators to try and prevent them from having what could be that train wreck in the future.
100% correct. Over there had asked me $1 million. That's where I think they're getting their figures because they had such major reductions in healthcare costs because instead of being reactive, they were proactive. They started putting programs in place to actually do something before they had to respond to something. Another one was, and this is a great example, influenza within children. Well, what they did was they took predictive models and started identifying who were the most at-risk children for influenza. And what the models came back with, there was one characteristic above all others that was the biggest indicator, and it was asthma. So they did an outreach program. They didn't throw money at it to say, well, we're going to fix this problem with money. They basically did a policy change. And they said, for all the kids that we know have asthma, we're going to reach out directly to them in call campaigns, in contacting their parents to make sure that they have, and we'll have mobile little, and I think they actually did mobile little vaccine things in neighborhoods. And they decreased the amount of children that required hospitalization by almost 26% in 1 year. This is the power of data. This is what data gives you. This is why I like it. It's kind of cool. collaboration among different branches to protect children. This is near and dear to my heart. What we're trying to do is we're trying to now, what they did, and sorry, I'll get to what we're doing. What they did was they started having different populations or different agencies start co-working on children to identify what are the drivers for the abuse. Not just abuse happened, but what caused it. Because the whole goal of taking children into state custody is not to keep them, it's to reunite them with their family at some point in time once you address the issue. But if you don't have the data elements to analyze, to understand what the issue is to begin with, how can you then give a realistic idea of when you're going to doing was identifying what were the drivers behind the child abuse on the individual level. Was it a life event, like a death of a spouse that just put somebody over the edge? Was it drugs? Was it homelessness? What were the events that caused the abuse? Because then we know we've got a program that we could put to this person. And that's when it gets cool. And I've probably taken more of my time than I'm allowed. The final one I'll just do is, and I think this is really important for you, understanding policy that was legislative and homelessness. And they actually came up with a way to define and measure their policy initiatives to the homeless population and what impact that policy is having. That is so cool. Come on. I mean, this is really neat stuff, because what they effectively were able to do is they were able to identify that certain policies actually were driving down homelessness, but other policies were actually being detrimental. And they've got a whole program of this called the Shadow Program. And it's where they start sharing data. And what was cool about this, they started sharing data with the CBOs, non-governmental agencies, the community-based organizations that actually are delivering these services. And what they were able to do is with that, programs for a given person was applicable, because that person may have had a drug problem, or that person may have a mental illness issue. Well, and the final thing they've done, which we talked about de-identification up here. In certain records, it's regularly mandated, and also at the state it's mandated, but a lot of cases for the individuals that are providing the service, it's critical that you actually do know who that person is. They're looking at, that was discussed here, at least the way my takeaway was, they're looking from a research standpoint. What Michigan did was look at it from a practical application standpoint. So they actually built a system that gave universal identifiers for an individual across all systems. And if you look at this little pictorial representation, this is a ton of different, had different identifiers for a given individual. Well, they sure of Rick, I need a universal identifier for him for everybody, because then I know what services Rick is getting, and I know what issues Rick has, and then I can discern what programs are best to address those issues. He becomes a successful citizen who's contributing to society instead of taking away from society. The final, their own PowerPoint was Michigan's EDW is a critical resource that has and will continue to benefit the state government and citizens. And the best part that they found about it is actually measures results. Instead of thinking, is this doing anything, to make sure, are we getting the return? And if we're not, what should we do different? So the question becomes, what can Georgia do? You really only have two, you only have two choices here. You can stay with business as is and stay within a siloed environment where agencies control their own data and kind of hoard it, or you can move to a more universal data infrastructure that should access it. And with the identifier versus de-identified, that's all security metrics, really. I mean, it's not as hard as it may sound, but within their systems, What they do is they have people that are authorized for certain views of data because it's applicable to their job. And it's authorized by legislation that they could view it. And other views they don't have. That's it. Any questions other than my exuberance?
I just had one. I want to say thank
Yes.
you. That was very informative. I could feel the light bulbs going off up here, actually,
cool.
right up here. But I wanted you to clarify. You are a Georgia company, right? There is a Georgia presence.
Oh, yes.
Here.
Oh, yes. I apologize. Yes, right now, we are a Georgia company, and we're actually doing an implementation right now at the Department of Labor.
And it's very important to me that we realize our state resources. So
Yes.
I wanted to give you that
Oh,
opportunity to.
thank you. Yes, I mean, we actually, we're a very big proponent in hiring in the place that we are. And this is really important and a differentiator for us specifically, but look, going down an integrated data warehouse is a necessary that we believe you should do. But more importantly, what you should all look for is a company that teaches you how to fish. Because to have a consultant on your book, so to speak, that just never ends is not the way to become autonomous and to start asking your own questions and developing your own strategies. Our basic premise is we hire within the state and then transition these people to become your employees, because that's where you drive the real value.
All right, well, it's a great presentation. Any other questions from the members?
And my contact information is also in there, so please, if you just want to talk about it, feel free.
All right.
Thank
Yeah,
you.
I mean, I think with all the speakers today, we're getting to, it's taken the third meeting, but we're getting to what are we trying to do? What are the problems that have certainly been identified and what we're trying to do? So we've got one more, so the pressure's on now to keep up with all. We've got from, I guess you just say SAS or SAS, and Kelly Farr here.
Yes, sir. Let's see here. Madam Chair, Mr. Chairman, members of the committee, thank you very much for allowing Eric and I come before you today to kind of present and give a little background on SAS. You'll see there's a big presentation we gave out. You know, we're running up against the end of it, so I don't know that we'll get to all of it. But I want to make sure you do see at the end, there's a representation of a lot of the use cases that SAS has done in different states and kind of the results of it. We weren't going to spend a whole lot of time on our presentation about that. We can talk to you later about it. But what we wanted to make sure we did was just kind of give our experiences and lessons learned in other states or paradigm change that the state of Georgia is considering. So just to kind of give you a little bit of perspective about SAS and who we are and kind of the context from which we come to you today to speak, is our very first customer in 1976 was government. It was the USDA. SAS was founded and still owned by Dr. James Goodnight, who got a grant from USDA to manage agriculture patterns. And there was so much data there, he didn't know how to manage it, so he started writing code to figure it out himself. And so from there, a small business was born, and to the point where it's the world's largest privately held software company. We're very proud of our representation in government. You'll see that we're not only active here in the United States, but globally. We're in all 50 states. We're in all cabinet agencies in the United States government, and then another 600 agencies around the world, as well as represented in over 80% of the Fortune 500. And we're also Madam Chairman, we're also very proud of our presence here in Georgia. SAS is headquartered in Cary, North Carolina, and we would love to invite y'all all up there one day to see our briefing center, as well as North Carolina Government Data Analytics Center at some point in the future, if y'all deem that's right. But on the left-hand side of this slide is all the customers that SAS, well, not all of them, but all the government customers SAS serves, as well as just some of the larger private sector customers. On the right-hand side, I just wanted to kind of point out some of the things we do in education. So Kennesaw State and West Georgia every year have a SAS Day, whereby they will invite back alumni, people from the industry that use SAS in their education process, had them come back to the university and talk to them about how that translated into the private sector and how they're able to leverage what they're doing today in the future. Kennesaw State's actually done it for the last 10 years. It's one of the most successful SAS days we have in the country. Dr. Kilcarney, one of our R&D vice presidents, sits on an analytic advisory board at Georgia Tech. And SAS is very committed to the state of Georgia and everything, government, private sector, and education. We have a regional office located right by Lenox Mall in Atlanta Plaza, where we do a lot of training, and we have a lot of employees housed there that support our customers here in the state. And with that, or I guess before, do y'all have any questions about SAS as a company before I move to the really smart guy in the room? Thank you. So with that, I'll turn it over to Eric Hundley, and he's going to talk to you a little bit about our experiences and what we found in these types of work.
So this is the third day that I've had the last presentation of the day. I call that character building. So as you probably will tell, hopefully I have a lot of character, well, at least in my own eyes. So I have some good news and some bad news. I don't know what Kelly was talking about. I have 45 slides and I plan on going through every one of them. Just kidding. The good news is I could say what Dr. Patterson said and the other presenters ditto. Are there any questions? That's a good thing. That means that we as vendors have experience and are seeing some of the same things and have the same recommendations and the same results. So I thought I'd take a little different approach. I've got this slide up here. It was our slide of saying the same things you heard multiple times a day about defining a holistic view of a citizen or a business or an entity. What I thought I would do is, because we're a little short on time, is I'd maybe kind of go through and summarize things and differentiate a little bit, if that's okay. And if there's any questions, we'll have time for that and so forth. So another thing I was thinking about, as we hear these things over and over again, I did a little research in the back of the room, and I wanted to know, like, if you heard of the Invasion of the Body Snatchers. By the way, it's the movie that's been reproduced the most times, so I didn't want to go through and repeat everything over and over again, but I thought that was the whole thing. But so I'll highlight a few things. And this is not meant to be derogatory in any way. It's just kind of our view on things. We think data warehouses are very important. However, the data warehouse is not the end. The data warehouse is the means to the end. It's not a if you build it, they will come type mentality. Yes, it's important and you must have those and it will save money. It does not replace systems. It can certainly consolidate data and make access to it much easier. But the value comes in when you start looking at what outcomes you can produce from that. Fortunately for us, I mean, what our background is, what SAS has recognized is analytics. Yes, we do data warehousing, we do data management, we do reporting and visualization, but we do analytics. That's our sweet spot. That's the things that Kelly referred to where SAS started from back and was incorporated back in 1976. And SAS is recognized as a market leader in that space. So we just want to make sure we talk about that. A couple things that I heard today I could repeat. Start small with an end state with the end state in mind. So I've heard don't use the Big Bang Theory doesn't work. The Taj Mahal was not built in one day. Whatever analogy you want to use is true. And we've seen that in successes we've had in North Carolina and in other states. Fortunately for us, some of the things that were mentioned today, the state of Michigan, some work that we're doing in Florida, the footprint we have in Georgia, a lot of the analytic examples are using SAS technology. We are in those states. So I'll highlight North Carolina, our home state. You heard Kelly mention the Government Data Analytics Center, or commonly referred to as GDAC. And what GDAC is very much exactly what was described today. There was a need, there was a problem that in many state governments, if you look at successful IT projects, don't look too far because you may not find many of them. We had a successful project in North Carolina. It was driven by a compelling event. In this particular compelling event, it was around criminal justice and public safety. We had a situation where there was a tragedy. There was a student body president of the University of North Carolina that was murdered, brutally murdered. And the problem occurred in that the fact that the individual that did this said crime was in our court system on a Friday night. Went to courtroom A, his paperwork went to courtroom B. He had an outstanding warrant that wasn't picked up by the magistrate, and he was let go. Within 24 hours, the student body president was murdered. This person should have never been out of jail. So we started with a project, and it was around criminal justice and law enforcement data integration project, just pulling and consolidating that data together. As a result of that, now there's all 99 jails within the state of North Carolina all warrant data, sex offender registry data, concealed handgun permits are all now consolidated in one environment. So that was one success. That was one thing in mind. There was one problem. It started out small, even within that, and grew. Now within North Carolina, we've taken that success and we've built upon that. We started looking at the data that was there. Now there's over 35 work streams across the state that are covering things from criminal justice and law enforcement, things in health and human services, some of the same examples we described today. Also looking at things from a transparency standpoint, education, and so forth. One of the differences that we've heard today that we're implementing in this particular project, it's a hosted environment. It's not sitting in the environment of the state. We actually have, we heard things like MOUs and memorandum of understandings and DUAs, data use agreements. All those things are in place that give access to us to host that in our secured hosting environment. We take on the burden and responsibility of securing and hosting that data. Should there be any problem, we maintain that responsibility. The other advantage of that is it allows us to fill the void where resources maybe aren't necessarily available and at your fingertips to do that work. Many times we see in state governments that we heard the term, they're maybe not as agile. Maybe the resources they have in place don't necessarily exist in a particular agency or aren't necessarily available to them, or they don't have the domain experience to solve a particular, like in the example of CJ Leeds, where there was 90 days required by the legislature to solve that problem, and we did that, is that and excuse me for this, I like to call that we have a gaggle of geeks that are available to us that are there for anything ranging from a DBA all the way to a quant statistician that we can use for 1 hour, 1 day, 1 month, or 1 year of a project to satisfy a specific problem. So again, if I was to repeat some of the things that I heard today, it was start small but with an end state in mind. Data protection. We heard things like redaction and de-identification and deduplication. Data destruction. Build from your successes. You let one success drive the next success and use that and what experiences you've had make the second and the first project and the third and so on. And wherever I can repeat that work and be consistent with that, the better off that I will be. Establish best practices. I'll give a couple of examples here, not to take away, because I had several that were almost identical to the ones we heard before, but I'll kind of highlight a couple that we've experienced. I mentioned the CJ Leeds example. And one of the things that we've seen as we've gone into other projects is that different organizations or agencies are interested on who's incarcerated or maybe who's deceased. We've seen projects where we're doing unemployment insurance and they want to know, well, which unemployment claims are coming from people who are currently incarcerated in jails and prisons in North Carolina. Or more importantly, which one of those are actually deceased. We see that in that particular area. Other examples are looking at, we heard about education before, is what impacts does education have, early childhood education on long-term direction and where somebody might be in the social services system years from now. A couple examples that we've seen in evaluating this data is things like third grade reading level. That is a driver to successful high school participation. And then also 8th grade algebra is a key indicator on when somebody's ready for college preparedness. These are just a couple examples where we're looking at data across that 360-degree view. We are not just looking at one particular agency, healthcare or criminal justice, but how I can leverage and benefit all those. So again, I didn't want to take up too much time. I want to leave time for questions. I didn't want to repeat what you already heard 3 times. I think all the vendors you talk to and the states you talk to are all great examples of where leveraging data for actionable insights is extremely important. It's paramount to the success, not only the public sector, but also the private sector. So with that, I'm kind of getting us back on track. I will open it up for any questions you may have.
Well, we first of all thank your presentation, and we don't mind hearing things a few times because us IT people, we have to kind of get hit in the head over and over to make it sink in. I know the problem Georgia State has. She's actually said that once before in some location, and I didn't catch it all. Today I starting to sink in, I think. Questions from the committee here? 23 is, I believe, your mic. Go ahead.
Yeah, you talked about designing for the end in mind. Currently today, my guess is that most of the analytics that are being done by governments are structured data, discrete data. my guess is that over time, unstructured space, does your types of tools lend itself to that, or are there tools that lend itself to that in the government space?
Yes, absolutely. In unstructured data, certainly becoming technologies that do that from a text mining perspective, contextual analysis, basically being able to look at a document or a narrative. You see this a lot in the criminal justice space, where as much as we love our police officers, a lot of times they don't want to fill out forms. They just want to write up a summary of what happened. So being able to go out and interrogate that data and pull out the nuggets of information that are important. Is it a particular car? What tied it, and pull that out and make meaningful use of it is certainly important. We also see it from a social media standpoint. We're working on projects around the area with during political campaigns that may be looking at how many complaints are coming through on potholes and things in the streets. They want to be able to read that information and be able to react to that in unstructured data.
Thank you.
I was just going to ask, just for that you mentioned here that you already have been working with, if there's one of those stories, perhaps you could share with us a measure of success there.
Yeah, sure. Well, about Georgia.
Yes, about
Oh.
Georgia. Yeah, I'm talking. I'm sorry. Yeah.
I'm sorry. I thought you were
The
referring to
first.
that. I'm gonna hand this over to Kelly.
Okay. Thank you. Thank you.
Yeah, we've actually, I mean, we had a very successful project very recently at the Department of Public Health with their WIC program.
Okay.
They applied for a USDA grant around WIC participant fraud. And so we completed a complete project with them that was hosted in our data center, and it's been very well received in the industry. Some of their people present on it in conferences and things like that. And so they're bringing multiple data sets into one spot, doing, the data management, the entity resolution, performing the analytics, and visualizing it back. They're actually bringing in other states' data as well to try to potentially find issues with people that are around our borders and things like that. And it's public.
Savings derived from that, or
I
you don't know what the
answer to
end
that.
result was?
I mean, we just completed it,
Okay.
so
We'll
I-
look it up.
Yeah.
Any other questions we've got from the committee members? Well, we really appreciate you coming here, and I know you didn't have a lot of notice on getting here, but we appreciate the presentation and look forward to hearing more in the future.
Yes, sir. Thank you. If there's anything we can do to address any questions, I'm local, so I'd be glad to come see you anytime. Thank
All
you.
right, well, I'm gonna try to get some information out to the committee members. We've got a little bit more work to do, obviously, but we're gonna try to look at some input on, what is it we're trying to do, what are we trying to design, and then, what's important in that, and then January too, so that'll be another part of it. But I'll try to get that out to you, and we'll try to hopefully have a meeting that we can get more attendance at. Friday is personally my worst day, but I know some people it's their best day, so we're gonna work on that. All right, any other comments from the members? Anything you'd like to see different going forward? If not, we're adjourned. Thank you for being here.
Some of their people present on it in conferences and things like that. And so they're bringing multiple data sets into one spot, doing, the data management, the entity resolution, performing the analytics, and visualizing it back. They're actually bringing in other states' data as well to try to potentially find issues with people that are around our borders and things like that. And it's public.
Savings derived from that, or
I
you don't know what the
answer to
end
that.
result was?
I mean, we just completed it,
Okay.
so.
We'll look it up.
Yeah.
Any other questions we've got from the committee members? Well, we really appreciate you coming here, and I know you didn't have a lot of notice on getting here, but we appreciate the presentation and look forward to hearing more in the future.
Yes, sir. Thank you. If there's anything we can do to address any questions, I'm local, so I'd be glad to come see you anytime. Thank
All
you.
right, well, I'm gonna try to get some information out to the committee members. We've got a little bit more work to do, obviously, but we're gonna try to look at some input on, what is it we're trying to do, what are we trying to design, and then, what's important in that, and then January too. So that'll be another part of it. But I'll try to get that out to you, and we'll try to hopefully have a meeting that, we can get more attendance at. Friday is personally my worst day, but I know some people it's their best day, so we're gonna work on that. All right, any other comments from the members? Anything you'd like to see different going forward? If not, we're adjourned. Thank you for being here.